Instagram and YouTube live session. I am Dr. Prabhjot. I am a pediatric neurologist, which means I look after disorders, which are all conditions which are affecting the brain, the spine, and the nervous system, muscles of kids. I work at Kim's Cuddles at Hyderabad. So today we'll be talking about headache in children. Headache is something which is very common, and every once in a while, as parents and as doctors, we come across kids who present with headache. Now, one thing is that headache is something which is considered quite unusual by most of the parents in their kids because it is considered something that affects only the adults. But the truth is that headache is pretty common in kids as well. And headache forms one of the commonest reasons why kids end up skipping school or have behavioral issues as well. So we need to understand that headache is most of the times, something which is very common and which is manageable quite well in kids. So the common causes of headache in children include one, something known as a primary headache, which means that the child is not suffering from any other problem other than the headache. And the other kind of headache is a secondary headache, which means that the headache is due to something else which the child is suffering from. So, to give you an example, a common cause of secondary headache can be a nose block. A child who has a fever, has an upper respiratory tract infection, or a nose block, has throat pain, can end up having fever. Sinusitis, in which instead of only nose block, even the sinuses have some amount of swelling or inflammation. Sometimes kids, if they end up having a trauma or hit to the head, they can have a headache. Many times, fever in itself can result in some amount of headaches. Other than that, another common thing, which again is considered a little uncommon in children, is high blood pressure, which can result in headache. And in fact, it is a common cause of secondary headache in childhood. But overall, secondary headaches are not that common. Primary headaches are more common, in which we do not find anything is abnormal, but our child is suffering from headache. So, primary headaches, the commonest kind of primary headache that happens in childhood is migraine. Again, migraine is something that most of the parents don't identify as that it can happen in kids. It is again something which is considered to happen only in adults. And even for adults, it is something which goes on for years and years together, years long headache. And before the parents or as adults, we realize that we have a migraine. So, migraine is one of the commonest childhood primary headaches, which means that it is one of the commonest headaches which does not have a cause. So migraines are something that we diagnose the most commonly in our OPDs as well. Now, migraine is very typical in adults. In adults, what we see is that we end up suffering from headache, which is usually on one side of the head. So it can involve only the left side or the right side of the head. It is usually associated with a throbbing quality, which means that there's a pulsating or a heartbeat kind of a pulsation that you feel in your head when you're having a headache. It is also associated with certain other features, like you become very sensitive to light. You would want the lights to be switched off. The sounds, even the routine sounds, irritate us, or especially the loud sounds become unbearable. Most of the times, you can have associated feeling of vomiting, which is nausea or vomiting also. So these are very typical headaches in adults. And similarly, these kind of characteristics can happen in kids as well. Now, the thing is, many times the kids will not tell that, okay, I have only one-sided headache. Many times the headache in kids can be diffuse, which means it can happen all over the head. But the other features are quite prominent in kids as well. So they can have associated nausea or a feeling of vomiting. They can vomit out at times. They may become very sensitive and irritable. They may want you to switch off the lights or draw the curtains. They do not want any sunlight in the room. They may want to sleep off. They may tell others in the house to not make sound or switch off the TV, and they just want to sleep off. In children, the duration of headache as short as 1 hour can be a migraine. So the underlying thing is that migraines are again very, very common, one of the commonest primary headaches in kids, and they are not very unusual. We would want the parents to know about migraine and identify headache as a problem, because migraine is something that is a recurrent headache. So a child can have migraine once, twice, or multiple times. But the good part about migraine is that most of the migraines in childhood as well as in adulthood can be managed. So migraines typically have a lot of triggers, which means there are few things or factors that a child is exposed to which can trigger a headache or a migraine in a child. So the common triggers which include are sleep. So a change in the sleep pattern, especially lack of sleep or late sleep time can result in a headache or it can trigger a migraine. Some kids, some specific food items. Many times parents may identify specific food items which causes the headache to appear in a child. Common food items which can result in a migraine attack include nuts, any kind of nuts, chocolates, especially dark chocolates, or when taken beyond a certain quantity, can result in a migraine attack in a child. Very highly caffeinated drinks like very strong tea, coffee, or cola colored drinks like Coke, Thumbs Up, energy drinks might trigger a headache as well. Another common thing which we see in childhood is missing of meals. A child has a breakfast but skips the lunch in the school or does not have lunch after coming home can end up with a migraine at the end of the day. Sometimes even changes in the weather, prolonged exposure to sun can trigger migraines in a child. So it is very important we try to identify what is the trigger. So very easy way to do is to maintain a headache diary. So in that we note the date which the child has headache and what was different in that child. Were we able to identify something which resulted in a headache? Did my child eat something different, which he or she usually doesn't eat? How was the bedtime of my child? Did she sleep late? Or did there were friends over, slept late, got up late, or there was an early school or an early event and got up early, that has triggered a headache, or there was a long sun exposure or meal was missed. So these kind of things we can note down in a diary, and over a few months or weeks, when every time the headache comes, it gives us a fairly good idea that what all are the triggers that is triggering headache in our child. And the main important thing about identifying triggers is that we need to avoid triggers, and it can really make management of headache or migraine in a child very easy. So we can make sure few things for every child who has headache, and specific triggers for a child who has migraine need to be avoided. Now, moving on from migraine, the other kind of headaches are usually not that common in childhood, which include tension type headache or cluster headache. Nevertheless, if your child is suffering from headache, it is good to bring your child to medical attention, bring them to a child neurologist, or raise this up with your pediatrician so that we can take appropriate steps to identify whether what is the kind of headache the child has and how do we manage it. Another common question that we end up answering in the OPD is that parents, the child has headache, and parents ask that, doctor, how do you diagnose migraine? How can we be so sure that my child has migraine? Please do an MRI scan or a CT scan for my child to identify it is a headache or it is a migraine. So most of the migraines are diagnosed on the basis of history. History means what you communicate to us, what you tell us about your child's condition, and what we examine in a child. So there's no definitive test, no CT, no MRI, which can give us a diagnosis of migraine. For a child with headache, there are few very specific situations which we will talk about, in which we will go ahead and ask for a investigation or testing. So other than these primary headaches, the other kind of headaches are a little uncommon. There are certain headaches in which you can have a sudden onset, lightning kind of sensation on one side of the head. There are few headaches which can happen around the eye. The eye tends to look smaller. There is some amount of tearing, nasal stuffiness. So these are little uncommon headaches, and we usually don't see them as commonly in our OPDs as migraines. Now, it is important to identify migraines again because we can manage them well. So, whenever a child has migraine or a headache, we would want you to take medical attention. Now, there are few conditions which we refer to as red flag signs for headache. Well, now, what do these red flag signs? Red flag means. So, red flag means certain signs and symptoms or certain clues which are happening in a child, which will trigger for a clinician to investigate further. So what that means is that the headache might not be that benign, it might not be migraine, it might be something sinister for which we might want to evaluate further. So the common red flag signs for headache include a few of these, so which I'll be telling. So if your child is waking up, has gone to sleep, is sleeping well, and gets up in the middle of the night and complains that I have a headache, and headache is something that has woken up a child from sleep, it is a severe headache. It is something that should not be ignored, and it should be brought to medical attention early. Other than that, if your child is waking up in the morning with a headache, or early morning has vomitings which are there for a few days. So these are not very benign signs. These are the signs that need evaluation. So these are the common red flag signs. If your child complains of headache, which is at the back of the head, or an occipital headache, it is again a red flag sign, which should be again brought to notice early. So these are the signs that we don't want parents to ignore. We want these kids to be brought to hospital or medical attention early. In addition to that, if your child, you see any changes in the way the child is behaving, a change in child's behavior, the way the child is walking, you see a change in the balance of the child's gait or the way he's walking, or you feel that there's a new onset squint, or the child complains that there is doubling of vision, there's slurring of speech, he's unable to use any hand or any body part well, it is always a very big red flag sign that needs to be evaluated very early. So once we as clinicians or you bring your child to the OPD, what usually we do is we take a history and we ask all these questions which I am talking about. We ask all these things to the parents, and usually we will also inquire about any parents having headache, because more or less a child who is having headache tends to have a parent who also suffers from headache, and many times parents themselves are not aware that they might be having migraine or a primary headache. Sometimes smaller kids, especially less than 4 or 5 years, might not have very typical headaches, but they might have other clues, which in later on in life might develop into migraine kind of headaches, like a child who has very intense motion sickness. You're traveling in a bus or a car, or in a hilly road, the child tends to get vomiting sensation. So it might be something known as a migraine variant. There are few other migraine variants as well, which may be there. Another important red flag sign is a smaller child who has headache. So if you're less than 6 years of age and is complaining of a headache, it is always a red flag sign, because kids that small will not complain of a headache until and unless it is really severe. And for us, it is always a red flag. We will always want to investigate this child. So, like I was saying, if we have a child who comes to OPD with headache, we will take all this detailed history, and beyond that, usually we will examine the child, see all is well, and we will usually ask for at least a blood pressure measurement, because high BP can result in headache, and it is something that needs evaluation as well as treatment. Beyond that, most of the times we will not ask for any ancillary tests like CT and MRI until and unless we find something abnormal in the scans, or if it is upfront something like a typical migraine, we are just going to go ahead with the management part. Now, there are few things about a childhood migraine that can really help us in management. Obviously, there are medications, but as pediatricians and as doctors, we want this medication use in migraine to be minimal as possible. So there's something known as SMART plan for kids who have migraine. So SMART basically means, it is an acronym. So it is the SMART means S is for sleep, A is for M is for meals, A is for activity, R is for relaxation, and T is for triggers. So S for sleep means that our child should have a good sleep cycle. It should be we should be following few sleep hygiene measures. Most of them include that we take our child to bed at a reasonably same hour daily. The child wakes up at the same hour daily, and as much as possible, we try to maintain this sleep wake timing across weekends and holidays as well. So in that situation, the child avoids getting less of sleep or oversleeping over weekends, which can result in triggering of a headache on Monday or Tuesday morning. Meals should be regular. We should ensure that our kids not don't end up missing meals. Other than that, if you sometimes see there are specific meal triggers for your child, you might want to look into that also. Third is activity. Some amount of daily physical activity, probably 20 to 30 minutes, has been shown to be helpful in controlling headaches. There have been studies that physical activity, especially yoga, may help in some amount of control of headaches as well. The next comes relaxation. Kids who are going to daily school have some amount of stressors in life, need some amount of relaxation. If the stress becomes something that they're unable to cope up, we have to identify that they're stressed, and we have to identify and give them options of how to improve the stress. And the last comes the triggers. So triggers, as we have talked about in details, the triggers we need to identify and avoid. It can really change the way the migraine is managed in a child. In addition to all this, we would really want that headache diary is maintained. In addition to identifying the triggers, it also gives us a fairly good idea that how many times has the child had to use SOS medications. So whenever a child comes with headache, we give something known as SOS medication to abort an acute severe headache so that the child feels relieved. The ultimate aim is that the child should have as less headache days as possible, and it should not lead to loss of school days or school absenteeism. So, and one is headache diary, one is SOS medications. In conditions where we feel that the headache is not getting better by lifestyle changes alone. So, the smart plan that we discussed about is known as lifestyle changes or lifestyle modification. If it is not working alone, in that situation, we might put a child on regular medications. But that, in our experience, is not that frequently required if we are able to take lifestyle modification properly. Now, another thing that is commonly asked is, and especially these days has become very relevant, is the use of screen time. So, as a part of the sleep hygiene, it will be better that the screens are kept off for a couple of hours before going to bed, because it can really interfere with the way our child is sleeping. The sleep cycle tends to be pushed backwards, so that our child ends up sleeping late, and sometimes the sleep is insufficient and can trigger migraines as well. So, in kids who present with any of the red flag signs, or we feel that there are additional abnormalities, maybe on neurological examination or on examining the child, we might order for additional tests like a CT or MRI. But upfront, most of the kids, we are not going to need these tests. So by and large, this is what headache in childhood is about. So my overall, to summarize the entire thing, what I would say is, see, headaches are something which are not uncommon in childhood; they are common. These are some things that should not be really ignored, especially if you have a small child who is less than 6 years old. If headaches are something that are persisting, we need to find out what is the headache and why is it happening. Most of the times, the headaches are benign, migraine being the commonest headache. Sometimes, when a child is suffering from any other concomitant illness, it can also result in headaches. But you should bring this to the notice of your pediatrician so that we don't miss out on something which is treatable and can progress over later time. Headaches most commonly can be well managed with few lifestyle modification measures, which can be done at home only, and medications are to be used as and when needed. Sometimes overuse of medications, many times there's a tendency to give something like a paracetamol or dolo, which is at home, to take care of the headache. Overuse of medications, which means if our child is taking these medications for more than 15 days a month, can result in something known as medication overuse headache as well. So we need to be careful about what medications are we giving, and medications are best to be given if they are prescribed by your child's doctor. So that is all I have to say about headache. So I'll be very happy if we can have some questions or doubts. So there's one. So I think there's one question: can screen time cause headaches? So screen time per se should not cause headaches until unless it is very extreme. It is resulting in changes in other aspects of the child's life. Is missing meals, or there's a change in the way the child is sleeping. It can result in triggering of headaches. What is the first state of migraine in children? So most of the times, once you visit your doctor, we will prescribe something known as an SOS medication. So usually it is either naproxen or paracetamol, and it should be given as soon as the child starts to display signs of headache. So the earlier in the course of the headache the medication is given, the better chances are that the migraine attack will be aborted. But again, as I stressed, this is something that you should take in after prescription from your doctor, and it is something that we would want you to add in your headache diary as well, because it gives us a fairly good idea that what is the routine use of SOS medications. Do we need to shift from use of SOS medications to a regular medication to prevent migraines? Is it normal for a child to have headache with fever? So see, if this fever is associated with something like an upper respiratory tract infection, throat infection, which is resulting in sinus blockage, it can trigger a migraine. But when a child does not have these things and there is headache, we as clinicians would look at other features which can suggest something like a brain infection. If there are any signs of brain infection, the neck is stiff, the child is dull, drowsy, it might be an indicator of a brain infection as well. So it is not usually normal for a child with fever to have headache, especially if the headache is persistent, it is not getting better, or the child is becoming very drowsy. or any other neurological signs are present. He's having vomiting, neck stiffness. So we want a child with headache and fever to be evaluated. So how do I know if a child's headache is serious or if a child has migraine? Again, the migraine has a lot of features like having only one-sided headache and has associated nausea, vomiting. But it is always best to bring it to your pediatrician's notice. Uh, and if it is serious or not, there are all these red flag signs. If your child is waking up with a night with headache, wakes up in the morning and tells I have headache, has vomiting, especially in the morning, and there's an underlying background headache, it might not be a very benign or it might be a serious condition. So it is always helpful to meet a doctor once. Most of the times, once you have met with the doctor, the headache and things are taken care of, you are also pretty sure that you're not missing on something which can be more sinister. Is Combiflame or diclofenac safe for headache in children? We would rather recommend using simple medications like paracetamol. Naproxen is something which is recommended. Again, but these overuse of these medications can have side effects as well. So we do not want kids to be taking a lot of over-the-counter NSAIDs or the group of drugs which come under the paracetamol family. Again, it is better that there's a prescription for these medications and they're taken only not more than twice a month. Again, Combiflame or diclofenac may sometimes be as a part of combination medicines. The kid ends up getting more medications than are needed. So we would again want you to, talk to your pediatrician before you use these medications for your kids. Okay. So I think that is all. So if there are no more questions, we can stop. So I think there are no more questions. If you have any questions regarding your child's headaches or you have any concerns regarding child's headache, you're always welcome to get in touch with us. So I'll be signing off. Thank you for interacting and being a part of our live session. Goodbye.